Your health. It's the most important thing in the world and the one thing most of us take for granted. You never know when it's going to fail you, but one thing is for sure, the best way to protect your health is to be well informed. Welcome to Your Health Matters. I'm Peggy Pico. Let's face it, we're not all really created equal. A woman's body is different from a man's, and because of that, a woman has different health concerns. Today on the show, we'll be talking about those concerns with experts from Eden Medical Center. Breast cancer is many women's worst fear, but it doesn't have to be. The medical field has made great progress in treating breast cancer, making surviving that type of cancer more common than actually succumbing to it.
Well, the facts about breast cancer today are that about 192,000 women in the United States will develop it. Only about 40,000 will die. So the survival rate is about 79%, and it's been improving in the last decade.
Dr. Michael Forrest of Eden Medical Center explains the increase in the survival rate numbers.
The improvements in survival in breast cancer are probably a combination of two things. One, better early detection with mammography, ultrasound, even MRI now. And the second factor is improved therapy. There's many more systemic therapies, hormonal therapies, chemotherapies that have been more targeted also and are improving survival.
And that is the key. Catching breast cancer in its very early stages greatly increases your odds of survival. Eden's Imaging Center is a designated breast imaging center of excellence.
We had to undergo a strict set of additional education and meet a number of different requirements to get this Imaging Center of Excellence accreditation, of which we're very proud.
With new equipment and tools available at the Imaging Center, experts like diagnostic radiologist Dr. Royce Chris can offer a full array of diagnostic imaging with state-of-the-art equipment, providing superior care for their patients.
The digital mammography gives us a much sharper image and gives us much better contrast between different types of breast tissue and gives us an increased ability to detect small foci of microcalcifications, which can be a precursor or something that would indicate that there might be carcinoma there. So we're getting a lot better images, and with those images we can now make better diagnoses. We can biopsy at an earlier date and hopefully find any cancer at the very earliest stages.
With these breakthroughs in early detection and the addition of drug therapies, doctors are now able to treat cancer differently. In some cases, they are even able to avoid surgery and mastectomies.
By far and away, the majority of women these days are candidates for lumpectomy and radiation. Mastectomy is an uncommon procedure. So the first decision, and a very difficult one for most women, is to just choose which procedure they want done.
Every case is different, and there are many variables to take into consideration when treating the cancer. For Annie Rose, she first had to accept the diagnosis.
I think I had a little bit of denial when I had my biopsies. I thought, oh, I'm going to be fine. I'm young. I'm 39. This could never happen to me. You know, I was a pretty healthy person, so I never thought this would happen to me.
Once past the denial, Annie geared up for the fight of her life.
I had a surgery on July 8th of 2008, which was a month after I was diagnosed. They put me on 3 chemos. They call it TAC, T-A-C, and they did 8 treatments once every 2 weeks. Then, after chemo was finished, we did radiation for a couple months every day. After I finished chemo and radiation, we went back for a follow-up mammogram and they found 4 spots on the other side. They said there's probably nothing to worry about, but I insisted that we do a second surgery because I just wanted to be done.
A lot of women who survive the treatment for breast cancer are going to survive till a normal span of life. And I encourage them to go back out and participate in life fully. Continue exercise, continue a good diet, maintain a good body weight, things that will lessen their risk of recurrence.
What a fantastic story. Now joining us is Dr. Anna Sapugai from Eden Medical Center. Thank you so much for being here today. When it comes to breast cancer, the number one question, who's most at risk?
Well, first of all, there's a misconception that only women get breast cancer. So both men and women can get breast cancer, except women are 100 times more susceptible to that type of cancer. As far as ethnic background, Caucasians have the highest incidence rates of breast cancer, but African Americans have the highest mortality rate from it. Other predisposing factors are early age at onset of menses, late menopause, women who've never been pregnant before, or late age at first pregnancy or delayed childbearing.
Delayed childbearing. And when we're talking about compared to other cancers, where does it rank? We hear a lot about breast cancer, and that's important, but it's not just because you're a woman, every woman's going to get breast cancer.
Correct. Breast cancer is the second most common cause of cancer deaths in women.
Wow, okay, so important, which brings me to the next thing. If you have a relative who has breast cancer, does that make you more susceptible, more likely to get it?
Well, it has to be a first-degree relative. So yes, if you have a first-degree relative, one first-degree relative increases your risk twofold.
And when you say first-degree relative, we're talking
Parents, sister, daughter.
And you said parents, that could even be if your dad has it?
Yes.
Okay, so pay attention if your parents has it, you know, it increases your risk.
And Peggy, if you have two first-degree relatives, it increases your risk threefold.
Okay, which brings me to the next question here. There is a test that a lot of people have heard of this, the BRCA gene test. It's a genetic test. Who should get that?
Well, first of all, let me explain what BRCA is. BRCA genes are essential in DNA repair, and as you know, people will recall, DNA is the building block for chromosomes. And when you have a mutation in that BRCA gene, that's what predisposes people to breast cancer up to 85% risk by the time they're 70. That said, only 5% of all breast cancer cases are related to this mutation. And therefore, no, not all women should be tested for it. But if you're a woman or a man with multiple family members who have breast cancer or ovarian cancer, then that should raise a red flag.
And those are the people who might want to be tested for this.
If you want to find out more about breast cancer, attend Eden's Breast Cancer Symposium.
Stay with us to find out about some of the newest additions on what's happening with moms and babies.